Hello, and thank you for tuning in to Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people who are making it happen behind the scenes. I'm Dr. Bobbi Pritt, Interim Chair of the Department of Laboratory Medicine and Pathology at Mayo Clinic in Rochester, Minnesota. With me today is Dr. Bill Morice, the President and CEO of Mayo Clinic Laboratories. This is our weekly discussion with Dr. Morice, in which we learn about updates in the field of laboratory medicine and pathology.
Hi, Bill. Welcome back.
Hi, Bobbi. Good to be back, as always.
As always, yes. And you were just traveling quite a bit internationally, coming back from China, right?
Yeah, Asia. So I was in Singapore as well as in Shanghai and Chengdu, China. So yes, the I was on my recent sojourn to Asia.
Well, the topics that we were going to discuss today are very applicable, and that's infectious disease outbreaks, right up my alley, of course. But when we think of global travel and the ease at which it could be accomplished today and how many people are doing it, I think it's really important to remember the impact of infectious diseases and how quickly they can spread around the world.
Yeah, I did. Yeah, I couldn't help but think about that as I was traveling. It's been a several. Thank gosh. I mean, it's been a long time since the COVID outbreak, but the reality that travel is back. Um,
Mhm.
every airport I was in was very busy, including Minneapolis, St. Paul when I finally got back. And so you're right. It's time of year when we're all traveling. As we can discuss, there are a number of different, pathogens that want to travel with us and do not nice things to us when we catch them. So it's good. It's good for us. We need to maintain awareness and thoughtfulness around this stuff. So what are you hearing now that I'm back? It seems like
Yeah,
the avian flu, the H5N1 is still out there in terms of
it
it's
is.
a newsworthy topic.
Yeah, that's a great place to start. You're talking about travel, and so respiratory infections are right top of mind. And of course, we have COVID and seasonal human influenza, but we also have this lurking potential threat in the background that is a low threat right now, but contains that potential, and that's H5 bird flu or avian flu. It continues to spread widely in the US among wild birds, but there's also this multi-state outbreak, 15 states, 500 dairy herds, and that's probably an undercount. And then we're getting these sporadic outbreaks in poultry flocks, mammals, including a pig at a farm in Oregon. And that's a little worrisome because we think of a pig as a potential mixing bowl, so to speak, for influenza viruses because they can be infected by avian viruses as well as human viruses. So there's a concern that viruses having this segmented genome could start remixing and become potentially more infectious to humans.
Yeah, we continue. I think, and that's why we keep watching. And as I understand it, there have been more reported human cases of the avian flu, for lack of a better term there.
Right. Yes, there's been 55 cases so far this year. The bulk of them have been in California, about 29. Most are farm workers that have mild symptoms, but there have been hospitalizations, and it looks like it's probably spreading further than we know. There was a recent study looking at serology, and they detected 8 people out of 115 farm workers in Michigan and Colorado, indicating prior infection, many cases which were not noted. So it is spreading. And now we so far have one adult in Missouri who did not work at a farm and has no known contact. So it's a bit of a mystery as to how that person got infected. And now we also have a child that's been infected. And so we're continuing to see these cases. They are sporadic. There does not appear to be human to human spread at this point. It's just that it's this background that we need to keep a close eye on.
Yeah, and because it'd be a new to human respiratory virus that if we can start to spread it between ourselves, could cause a wave of infection like we've seen before. I think the good news, as I understand it, is the tests that are out there for influenza will detect this. It won't specifically say unless you use a very specific test if it is that strain of influenza. But my understanding is that the tests do work and that their public health is engaged to kind of surveil for the risk. If I'm up to date with all my.
You are. Yes, you're always good at this, Belle. We still should recruit you as a microbiologist. So we have the rapid diagnostic tests, the immunochromatographic assays. Depending on the target, if it's a conserved target, then yes, that probably will be detected with our rapid antigen influenza tests. But like you said, it wouldn't actually tell you the subtype, and those tests may not be as sensitive for avian flu. Same thing with the PCR assays. Again, most molecular assays can detect influenza A and a broad range of influenza A subtypes, including H5, but that depends on the region and how conserved it is. And we also know that there isn't necessarily typing, although there are some typing assays. This really comes down to the role of the public health lab, though. And if clinicians see patients that have these risk factors that have a respiratory illness or conjunctivitis, that's another symptom people have been presenting with, a sign, then they should think about getting testing through our public health lab specifically for H5 avian influenza.
Got it. Yeah. No, it makes a lot of sense, and it is something that's worth watching. I mean, it's because we've learned, and like you and I talked about during the height of COVID, early days, a pandemic phase. This is unfortunately not going to be the last time. Hopefully, it'll be the last time in our lifetimes that this will happen, but
Mhm.
it's something we need to watch. I think the good news when I traveled overseas, obviously, the whole topic of COVID is when you're in Asia, particularly in China, it can feel kind of sensitive. The reality though is that everyone across the globe is really engaged around trying to prevent something like this from happening again, and really paying a lot of attention to testing for different pathogens, and really watching from a global health perspective. So I think that's heartening. The other thing that's interesting is to think about just what other parts of the world are confronting, and how they have some of the same themes that you and I have talked about, but they're a little different. So there's still a lot of concern internationally. We mentioned this when I went to Brazil, but in tropical areas where your expertise is as well, but around like things like dengue and the spread
Right.
of dengue fever, into more, north, that you and I have talked about, like some of the tick-borne things as tick population spread north, with global warming. There's also concerns around the spread of dengue and testing for dengue. How much needs to be done? Can they develop tests to see who's going to get seriously ill with dengue? So it's not. So we're not alone. I mean, this really is a global fight, and there with some regional sorts of emphasis, but the reality is that all these things have the potential to spread across the world. Unfortunately, I think.
Yes, you're correct, Belle. And we think of infectious diseases and the different way they could be transmitted. So, of course, we have our respiratory virus infections we were just talking about. But then you have something like dengue, which is vector borne by Aedes mosquitoes. And we're seeing populations of Aedes expand. They're into different areas where they're not endemic. They carry these diseases. We're seeing dengue outbreaks, serious dengue outbreaks worldwide. So that's a concern. Then, of course, we have other viruses that may be transmitted more by close contact, like Mpox. And we just had a case of clade 1B. Clade 1 is considered more serious than clade 2. And there was a travel associated case of Mpox clade 1B in California that was in a traveler. So it really gets to your point of how, regardless of the means of transmission, whether it's mosquito bite, respiratory virus, contact, people with these infections can show up anywhere in the world, and you can traverse the globe in 24 hours and really end up potentially spreading infectious diseases quickly. That's why it's so important to have good diagnostics, to have good surveillance, and essentially good public health.
Yes. Yeah, it's funny because I thought of you. I think I was in China, but a mosquito came and landed
Oh no.
I'm like, oh no, what is up? What did I have in him? Please don't bite me. I don't have I didn't follow my ABCs because I didn't think of it.
Oh
But
no.
yeah, I did the best I could, but I didn't have bug spray. But no, I think you're right, and I think it just goes back to a couple things, just to step back and say, what does it mean for me in particular? Number one is to, as we travel here, just to think about, you don't want to get sick. You don't want to make other people sick. In China, where I saw masks pre-COVID, there's still more, but think about if you're on a plane that's crowded and you're traveling in a crowded setting, thinking about bringing masks with you, it will help protect you. If you are feeling ill, to think about attending or not attending some of the holiday events that will be coming up. And the other thing which you really is important, which you pointed out, is, and that is, if you feel, it's still worthwhile to get tested. If you feel sick, if you have a rash that you can't explain, it's for you, it's also for those around you to understand what you might have, right? So you can get the appropriate care for yourselves and take the appropriate measures to prevent others from around you from getting sick. So that's really what it boils down to in the end, as well. And it's easy to try and put all that in the rear view, but the reality is these things are going to be with us. It's part of life as we go run around on the globe.
Absolutely. And it also comes back to being an advocate for yourself and making sure you're sharing good information with your clinician when you see that person. If you've recently traveled to a certain area, if you've been bitten by mosquitoes or ticks, these are important things to share with your physician.
That's right. Well, I guess that's another great conversation. It's, as always,
Yeah.
you're looking very festive with red on, and we're getting into the
Yeah.
holiday season here. So
I know.
this actually has red. I don't think it's coming through if it was on video. I have a little red in my jacket, but so not as bright as yours. But yeah, just again, as we get into the holiday season here, happy holidays to you and your family and everyone that's joining us. So.
Well, thank you, Bill. And I will also say happy holidays to everyone who's listening. Stay safe this holiday season. If you're traveling, think about some of the infection precautions that we just talked about. And we will catch up with all of you after Thanksgiving later, and we'll have more to share.
That's right. And as you travel, if you are traveling in the car or anywhere else, and you have some extra time, download a podcast. And
there you go.
From the lab. There you go. On Spotify and other channels.
See you all next time.
See ya.
Thank you so much for tuning in to Answers from the Lab. Be sure to subscribe to this podcast and don't forget to tune in every Thursday and every other Tuesday.